what these patterns were that I saw, I'll identify, or at least I'll illustrate for you by means of newspaper clippings that I'll read for you. As I give this talk, by the way, my advice is that you relate it to yourself. That you don't just see it as an academic exercise or as a storytelling, but just see to what extent you recognize these patterns in yourself. So the first clipping here is by a woman who writes the article herself. These are all from the Globe and Mail. And she's diagnosed with breast cancer. Her name is Donna. So she's diagnosed with breast cancer. And her doctor's name is Harold. Her husband's name is Hai. And Donna is the second wife. The first wife died of breast cancer. Now Donna, the second wife, is diagnosed with it. And so Donna writes, Harold tells me that the lump is small and most assuredly not in my lymph nodes, unlike that of Hai's first wife, whose cancers had spread everywhere by the time they found it. You're not going to die, he reassures me. But I'm worried about Hai, I say. I won't have the strength to support him. And what do you notice? Her first and automatic thought is, how can I support my husband emotionally as I'm dealing with a potentially fatal illness? So this compulsive and automatic concern for the needs of others while ignoring your own is a major risk factor for chronic illness. The other clippings I will read you are obituaries, all from the Globe and Mail. Obituaries are fascinating because they tell us not only about the person who died, but also about what we as a society value in other people. And often what we value in other people is exactly what kills them in the first place. You heard the expression, the good die young? They do. And there's reasons for it. A lot of you are heaving a sigh of relief. Okay, I don't have to worry about myself then, you're saying so. But listen to these obituaries. This one is a doctor who died age 55. And I'm talking here about people who died before their time. This guy dies at age 55 in Toronto of cancer. The obituary says, and this is written as if it was a good thing, never for a day did he contemplate giving up the work he so loved at Toronto's Sick Children's Hospital. He carried on with his duties toward his year-long battle with cancer, stopping only a few days before he died. Now, think about that one. If you're diagnosed with cancer, or if a friend of yours was diagnosed with cancer, would you say to him and her, hey buddy, here's what you do. Go back to work tomorrow. And all the time that you're getting chemotherapy and radiation and whatever else you're going through, just work every day until you die. So this compulsive and rigid identification with duty, role, and responsibility rather than the needs of the self is a major risk factor for illness. The next obituary is written by a husband about his wife, Naomi, who died at age 55 also of cancer. And he writes, in her entire life, she never got into a fight with anyone. The worst she could say was phooey or something else along those lines. She had no ego. She just blended in with the environment in an unassuming manner. Now, the suppression of, in other words, she never got angry with anybody.